And in our remaining few minutes here with Congressman Murphy, we've been talking a lot about the mental health bill, its status, its developments, its virtues, benefits, and what some say is a flawed bill that is nonetheless needs to be dealt with in a reconciled version with the Senate.
It's not flawed. It's a great bill.
I agree with you. Number two, Representative Joe Kennedy says that this cannot be considered to be the ultimate bill.
No, because we need to spend money.
Yeah, he says we've got to spend money. We've got to get people that are going to be psychologists. We need to make sure that there's greater reimbursement of Medicare. In other words, he's talking about making a greater priority.
We have to. We have to. It is, you know, I'm glad some people towards the end were finally getting engaged in what we had to do, but clearly it's a $500 billion a year cost, mental health in America, when you add the health care costs, the lost wages, lost opportunities, law enforcement, judicial system, $500 billion, $500 billion. We need to be spending money to stop the wasteful money. And that comes on multiple levels, whether it's Medicaid or judicial system. We have to do that.
Yeah, and he gave voice to that. So this would be a big piece going forward, hopefully, and there'll be other elements that could be added on in time. Let's talk a little bit about another issue that the audience is quite familiar with all through the tri-state, and it's only getting worse, the opiates. I've read an article that took this point of view. You wanted legalization of marijuana. You got legalization of marijuana in over 20 states or so.
Bad idea.
Okay. And as a result of that, the people, particularly the cartels, who are businessmen, say, okay, you've taken that away from me. Now we're going to generate something else. And that something else has people dying while they're standing up. And I understand there's literally something now coming in through Ohio that's going to be hitting western Pennsylvania, if it's not already here, that makes the fentanyl heroin combination, I don't want to be trite about it, but not as bad, and that's hard for me to even believe.
They have, there is a race, I mean, just like anybody else trying to design a better car, for people who are addicted to heroin and other substances like that. They're looking for bigger highs. Several things happen I need to lay out. One, in 2004, the American Medical Association said pain will be one of the indicators, along with respiration, heart rate, blood pressure, etc. So push for doctors to ask, are you in pain? On a scale of 1 to 10, what is it? Then they got to treat it. Also pushed by pharma. More medications available, more opiates, more powerful opiates out there. I mean, I heard from dentists, for example, saying, you know, I'm only allowed to prescribe for a few days. Can I just give a 30-day prescription or a 60-day prescription for Percocet if someone has a bad toothache? And my point is, no, you need to monitor that. Because that goes to the other point. Physicians are not trained. They're not trained in medical school, not trained in residency, trained to say how you monitor an opiate to watch for an addiction. I've talked to people who are high-level executives. They have a back injury, they have back surgery. Next thing you know, they say, I'm addicted to painkillers. I got to get off. So they get off, and they're looking for something like heroin or something else to follow through because of their addiction problem. Here's another thing. 2009, the Affordable Care Act has questions that hospitals must ask patients when they leave. They fill out a questionnaire. Some of those questions have to do with how well the doctors handled pain. Was your pain handled adequately? If they don't score well on that test, that hospital doesn't get as much money. So what do you think the incentive for the hospital is? Write more painkiller prescriptions. On top of that, the way the federal government handles this, much of the emphasis is on medication-assisted treatment. By getting prescriptions for buprenorphine, methadone, etc., says, well, in order to keep you off heroin, we're going to give these other drugs. Here's the problem. With buprenorphine, it's the third most diverted drug. People get it, they sell it. Many times doctors write the prescription, they don't even with the urine to see, are they taking heroin or something else? They don't do random counts to call up. Some drug centers do. They'll call up and say, hey, Joe, go to pharmacy. You got 1 hour. We want a pill count to find out, have they sold it off? We found a sizable percentage of Pennsylvanians actually have gotten enough pills for 600 doses a year in Pennsylvania. How are they doing that? They're going to different doctors. Why do they go to different doctors? Because there is this list out there that you should have to make sure that a doctor can check to see if you already had a prescription. We don't do that, and we don't have enough providers. All these things have cascaded. You can't arrest your way out of this problem, and legalizing marijuana is not the answer too, because now we have an increase in adolescent psychosis coming with that, because a study done at the University of Pittsburgh shows that link as well.
Okay, good. I'm glad you're able to touch on that, as you did earlier. The depression issue I raised was in the paper today. Talk a little bit about the 9/11 airlift.
Exciting news. You know, we worked really hard to help our military base. So we're proud. It's a great town for that. We're glad the Navy is based up there at the 9/11. That's the Air Force Reserve. They got the big C-130 transport planes with the 4 propellers. It's going to change the jet engine, the C-17, much bigger capacity. That's a plane can be loaded in Pittsburgh and flown to Afghanistan instead of hopping its way in the lily pads along the Atlantic or Pacific. It's an amazing thing, but we got $85 million. They'll be building new hangars, new fuel tank preparation systems, new buildings. That means the planes can move in, and that means about 300 civilian jobs and more Air Force jobs. When we get the Air National Guard, when they get their new planes, that'll be more civilian jobs. So we're building the military force at the airport area to be a few thousand now, and many, many more civilian employees. So it's an exciting opportunity for us.
Yeah, I mean, that whole area seems to have a lot of exciting opportunities, whether they be military, civilian, or anything in between, retail and so forth. And that's very good news, and particularly with base closings being such a high item nowadays. So I know it's a big fight. I'm going to have to stop right now. If I ask one more thing, we're going to be here for the next hour, and I'm going to get yelled at. Next time around, somewhere around the election, maybe perhaps we'll talk about what we could expect on election night. Thank you so much. Keep up the good work.
Thanks for the opportunity.
All right. Congressman Tim Murphy, of course, Republican, Upper St. Clair, and always a pleasure and a privilege to be with him. We're going to come back and tell you just how bad a day Ryan Lochte had as a result of acting foolish down in Rio. We're also going to be talking about going back to school. Audrey Gutsky will guide that conversation.